Very similar, but I'm going to talk about the corner lift episode. So, it was named again, Dr. Flowers named that Valentine mouth rejuvenation, and I'll tell you the reason why he named it Valentine Valentine corner lift. The mouth region, along with the eyes, are the two primary foci of human communication. It has power to override the eye messages, and it owns a dominant role in broadcasting our disposition. So with advancing years, I know there was some discussion that things stay where they are, but around the mouth region for sure they don't, because the upper lip lengthens and the lip vermilion thins and lines start appearing and the lip pucker disappears. Corners of the mouth turn down, the bony support shrinks, the nasal tip drops, the columella-labial angle gets narrow. So we have to pretty much address all these areas as they appear. The end result of aging is the negative line around the mouth. Some of those pictures, I agree with Dr. Terry, that I was told, and I do isolated lip lifts, which I'm going to show right now, but when you do the upper lip lift, in my opinion, you have to do the corner lift regardless if you look at it, because once you pull it, the corners will go even further down and it's going to be exaggerated. So the thin lip, downturned mouth corners, and it gives us that grumpy, sad look. And I tell the patients, you may be the happiest person and you are okay, but if you're at Starbucks reading your book, you look sad and upset, and they all agree that they were told that. So something about that lines around the corner of the mouth make us look grumpy and sad. So the artistry of a successful mouth rejuvenation is understanding these lines, the power of these lines, and conversion a negative line to a positive one. So how do we fix it? We agree in many areas with Patrick, Alex. How do we fix this? By not relying on fillers alone. Again, I'm going to probably get some heat at the end of the talk, but I don't remember the isolated, probably Juvederm radius I injected on a lip, maybe one or two once in a blue moon. And maybe my patients are a little older. If a younger patient comes, there is no problem on the corner. Yes, you can augment, but the patients that I'm going to show, my patients, some insist that they want Juvederm, and I simply do not inject, because I know that trying to fix that corner of the mouth with the injected in soft tissue fillers alone, you're going to make the things worse. Because what you're going to do, you're going to try to inject to the corner, try to evert it, and then you're going to end up with these sausage lips. So again, when I say the only way to fix this problem, I'm talking about the corner of the mouth, and it's the Valentine mouth rejuvenation. And of course, if you want the natural lips. So what is the Valentine mouth rejuvenation? It's a combination of lip lift, corner of the mouth lift always, and when required, upper lip shortening as well. And the second part is injection of soft tissue fillers. And I'm going to show a surgical technique, which in that one I'm using Juvederm for whatever reason, but almost always I use radius, and I'll tell you why. Because I pretty much don't inject much into the lip at all. And the third part is peroral CO2 laser resurfacing. I'm using the fractionated CO2, and actually Flowers told me, I have been doing the phenol peels in isolated patients as well, and some of those patients, and I'll show you, but after I got my CO2 laser, it works really well. It has a nice tightening effect, and the one thing is, instead of hypopigmentation, maybe hyper, but I almost never see the hypo version of the pigmentation. So corner of the mouth lift, this is part of the technique. The reason it's called, again, Valentine, because the small skin flap is a design of lopsided heart. So that's why he called it Valentine. And to your comment, Patrick, in terms of that dog ear, is going to be fixed with this little lopsided Valentine. Because if you just do an elliptoid excision on the corner, you're going to end up with the dog ear here. But by doing this, that curve is going to lengthen the scar, so at the end you're going to have minimal to no dog ear, and if you do, you make another millimeter cut and you fix it. I'll show you some results. So that's our result after. Upper lip lift, upper lip shortening, and one thing also I do a little different than Patrick, so I don't know if Alex does the same thing, but when I do my markings, I saw that this part of the incision came inside the mouth. I do the same thing, and it has to come in front of the columella. But when I do my markings with the caliper, I get pretty much the exact length. So my lower incision, instead of like the Patrick showed, instead of going like this, it's kind of curved. So at the end, I left the pretty much exact same amount of upper lip on that region. And no matter what you do, in this portion, when you close it, even if you go around the alar groove, you're not lifting the lip. So this part is not going to do anything here. So that's why you must do a little corner lift at that area. And I agree, it's a bloody procedure. I actually do that under local anesthesia. I don't even have a suction. I just inject, and I use with the scissors and put some sutures. And this is the lady I did actually phenol peel, and you can see some hypopigmentation. But she had the upper lip lift and corner of the mouth lift. And injection of the soft tissue fillers, and I'll show you on the technical video. As they said, it's really important to create, either maintain or create these lip lines. And the precise cupid bow and filtral columns, a little indentation in the middle, and even this gray line. And that's the same thing on the lower lip as well. So I pretty much inject just like that on those areas. So I pinch and I inject that area, not to augment the lip itself, because with the lip lift and the corner of the mouth lift, you're pretty much bringing that lip back, the natural lip. You just want to augment those filtral columns. And one thing though, I kind of missed your point, Fred, but the way that I see it, if the filtral columns are too wide, I don't think that they look natural. So when I do my incision, I think these filtral columns should go to the pretty much narrowing and lateral side of the columella, and it should go out that way. But and this is her result.
What I'm saying is that the caudal end of them don't meet up with the peak.
What is that?
The caudal end of the filtral columns don't end up at the peak the way they're drawn. If you just look around the room on the break, and you'll actually see that the filtral columns just to the side.
Oh yeah, no, I agree. But what I'm saying is, it doesn't go that wide. It should be more like a triangle, but
Yes.
not to the tip, but around here. There's a little gap. But if you bring it too lateral, then it becomes too rounded, and especially if you're not doing that lift part. And the parallel CO2 resurfacing, I personally like it with the fractionated one, especially right in front of your eyes. Same thing with the eyelid. It literally shrinks the skin and evaporates, and it's quite impressive tightening when you do with the fractionated CO2. So this is hers. And a little technique, let me. So I make again, you can see the little lopsided heart. So after I do my infraorbital and mental block, and then inject on that area as well, and I mark filtral columns and cupid's bow, of course, in advance, and then after a little small incision, I remove that little skin with the curved iris. And it's important not to excise the muscle, because if you excise part of the muscle with your excision, then you're going to end up with a contour deformity. You have to be literally right underneath the skin, and once you remove that skin, when you put the skin back together, again, no undermining. Your goal is to lift that, so you don't want to undermine the skin on that corner, except maybe on the very lateral if you're trying to fix the dog ear. I'm going to advance the video a little bit. So that's after the excision. And I use 6-0 sutures. Same thing, I do the 6-0 Maxon or PDS sutures on the upper lip part as well. So the first thing I do from that pretty much the corner to the lower end of the heart, I put the first suture. So after just tying that, it just shows you how it is. And a little bit, and I put several interrupted sutures, and I do the same thing because I remove these sutures really soon in 5-6 days. I use the same PDS suture over and over running afterwards, but I don't do it first because I know that I'm going to go with the CO2, so not to evaporate my suture, so I do the deep sutures first, and then, which I'm going to show, I'm going to do the injection part next, and afterwards I do my CO2, and after the CO2 is done, I just go and close the skin over and over. Okay, this is, so I, again, it's Juvederm, but I have to say, really 90% of the time I use radius. The reason is, I want to create that little ridge, that little hardness on the filter column. Again, with the Juvederm, doesn't matter how careful you are, it tends to round the lip corners. I want a nice precise angle with from Cupid's bow, from that peak to the gray zone and the filtral columns, and with the Juvederm, everything becomes a little rounded, so that's why most of the time I use radius. And if I'm going to inject something inside the lip, I do the Juvederm, which is fine. And so I inject like 2 layers, I go superficial and deep with the same filtral column from the peak of the Cupid's bow first, and then literally with my hands like a Play-Doh, I just contour it, I squeeze it, and I open the 4x4, make it really thin, so when you kind of squeeze the skin, your glove doesn't even slide. So I do that. I want to make sure that that stays exactly where I pinch that filler, radius, or Juvederm. And after the filtral columns, so I do the, again, gray line, vermilion border essentially, and afterwards a very little amount, of course, on the Cupid's bow itself. Because you're injecting very close in the same area, you really don't want to add too much there, not to make it round. So that's the injection part. And as I said, with the open 4x4, you literally squeeze in different angles. And I do the same thing, I agree. I always do the lower lip as well. It's your lower lips look also, it looks beautiful after you're done. It just exaggerates that vermilion border. I literally pinch and kind of distribute everything. When you squeeze, even if it goes to the skin, which if it's not thin, that's the part that makes the skin looks really, the lip looks really unnatural. So you have to squeeze it to the tip so it's natural. You really don't want anything on the skin of the lip. You want it at the vermilion of the lip. So some I inject to the lip again, like it's shown. And then I do the CO2. This is the fractionated CO2. I go a little aggressive. But I tell all my patients, I educate them in advance saying that, look, I can be less aggressive. I can do really minimal. Then at the end, you're going to have comparable skin improvement. Or, with this laser, I can adjust. I can literally, you can cut all the way to the bone. It's that powerful. So, but if I do it a little aggressive, yes, you're going to look really rough around 7 days, 10 days, and you're going to look red several weeks. But at the end, you're going to have the best skin. So they kind of tell me, if they are educated enough, they are anticipating, if they want just a weekend rejuvenation, a little peel, I don't do it anyways. I say just go deal with whatever in your life, go to your cruise, your wedding, and come back afterwards. Because the way I do it, this should be a one-time thing. And afterwards, I just, yes, as I'm showing, through and over and over closure. If you need to fix any dog ear, you can do it at the end. And that's pretty much it. It's like a literally half an hour, 45-minute procedure, completely awake, and they just go home right away. So this is the patient, and this is the markings. And the other thing is, when you mark them, of course you're going to mark them when they're laying down, but then you have to do it a little more, because with the gravity, when they stand up, even though you're removing skin, sometimes you don't remove enough. Of course, you don't want to remove too much, because then they talk about this Joker face, smile, and you don't want to show too much lip at the corner. The lip is the highest in the middle, and it tapers down like a triangle, but you have to be able to see the corner of the mouth. But if that one is lifted too much, then you have a rounded corner, which looks terrible as well. So it's just a balance. And this is her, I guess, right before the laser, after the laser and the closure was done. And you can see that a week later, I mean, it's pretty much peeled and the sutures are removed, still red. And this is her after. So it's, and now these patients, when you look at the after picture alone, you won't be able to say that they had a major lip procedure done. Again, I'm going to show quite a bit before and after results. Just focus on the corners again. And whenever I did the, on this case, let me see, I think I did the, I'm not sure if I did the short on that one, but I think I did. This one for sure I did. And afterwards, this is another patient that I showed before. I did the lip shortening and corner of the mouth lip. And if you look at it, it's completely plain in this area, and you can clearly see the filtral columns and cupid's bow. It's another patient, just the Valentine mouth rejuvenation, no lip lift. And again, if you don't fix these areas, they make them look really sad and upset. And this gentleman actually I did without any lip short, any injectable, just the corner of the mouth left because he was drooling. So it just removed a little bit of skin and just fixed that area. And the scars look really good. Essentially, when they talk about the scar, I tell them, you know what, you have a very deep, terrible scar here anyways. What's the difference between that or a tiny line? So it's just changing the direction of the line. And this, same thing, if you don't address that, that's actually a deep scar, like a surgical scar. And now one. And she doesn't have much, actually pretty much she looks okay. On her, I did a little modified one, a small Valentine. Again, you can change the extent how much you're going to remove according to the patient. And in that one, I did a small one. Again, still looks good, improved. It's just a little bit more pleasant. And I showed this one before. And one of the hairdressers, one of my patients, said, you can see, I mean, it's all dark on the corners, even though she's a younger patient. And afterwards, she's not a smoker, but you can see so many these lip lines, and it just doesn't do justice. She was just like 40s, and this is her after. And this is one of the last ones that I did, and one more. I've seen that patient out of town, and this is probably 2 or 3 year post-op picture we published. And I'm gonna say the last part of Dr. Flower's poem. Again, it's the jaw lines and frown lines and vanishing moles. It's lips full on shapely and the stuff in their souls. So it's not about the facelift all the time. I think the small things that you can do, and one of the probably most common things that I do in my office is Valentine, and it's small enough procedure and it's odd enough that I have patients out of town, out of state, just come for that procedure. So they come, enjoy the beach, and go back. It's really straightforward. You just don't want to remove too much and mess it up. It's better to remove a little less. You can always remove a little bit more. But if you remove too much, then you're in trouble. Then it will look terrible.
Right. How does that? I didn't see any patients of any kind of color. Do you do any Hispanic or Asian or anybody else?
I guess I do. I mean, I'll look at my website. Not as common, actually. I'm in Panama City. I don't have many diversity there. But in terms of laser and peel, probably I wouldn't, or I would do it very light. But the Valentine, I would do it. Injectable, I would do it. And most of the time, if it's African Americans tend to have, thicker, bigger lips anyways. Probably there's not much interest that they come. But I wouldn't discriminate. Alex?
Well, you showed some very nice results. I just have a question concerning this corner lip. The original technique describes a small extension of the incision along the lower lip so that you get a transposition. and that avoids to
It rounds, sorry to interrupt, but it rounds the corner of the lip. You know, my partner tried that, and actually, because he was insisting, oh, you know, we can do that, the scar is gonna be there, and I let him do in one of his patients, then I fixed that. So that's why I agree with you, it's almost like a little Z-plasty that you can do, but then you don't have that nice sharp definition, that corner becomes a little rounder. The way I mean, I have a lip fetish, and I really enjoy looking at a good lip, and it has to taper down all the way to the corner. I don't like it round on the corner. And this is a lot easier, to be honest, and especially if you're doing some kind of resurfacing procedure, you really barely can see the scar. And at that age, if they don't mind putting a little bit makeup anyways. If the goal is don't put any makeup in 50 or whatever, and look under the light to be able to see the lines, while they are showing me that one small line, I can show them 100 lines on their face that is pretty much the same. So I think it's a good trade-off.
Yeah,
But,
I use it quite a lot as well. Do you ever Botox the DAO?
I never do Botox around the mouth. I mean, one of my colleagues, I did actually, she had some twitching, and she really forced me to do on that area, and I did one, and then she had a little drop, and we had to do the other side, and I said, I will never let anyone talk me into it. I know it may work, I haven't tried, so I'm not going to start trying. So
it's very easy, it's very powerful, especially for these dynamic negative lines, because sometimes you can fix it surgically, it's very nice, and then they have this expression. My mother has that, and I also have it a little bit, that I tend to pull the corners of my mouth down, and you actually make one Botox point halfway between the commissure and the angle of the mandible, the border of the mandible at half depth, which is in the body of the DAO, and then the second one just on the bone, and it's away from the corner of the
how much do you inject? What was the dose?
I usually, in Botox terms, 2 units, and it's very safe. You will never have any drooling or any dysfunction in the lip, because I Botox.
So literally on the marionette line?
Yeah, you can, some people can animate, and you can feel it contract, and makes it easier, but otherwise it's in the marionette, just medial of the marionette, just, and it's very safe, and you should try it.
Sure, I may do that.